They also have a bit of a skewed perception of pain. Some of this is because I don't know if you guys ever stretched. It's not the most comfortable thing in the world, but it's normal for dancers. Also, if you can kind of see the point shoe that's getting passed around, it's not kind to the foot. So for some of those reasons, their perception of pain is like, oh yeah, you have to have pain, kind of the pain no gain thing. Also, as you can kind of see by our little picture up there, you don't get that way by being unflexible or not strong. So dancers tend to have a lot of strength at end ranges of flexibility. Dance classes always start with a warm-up, and then the movements start small, and then they progress into like the bigger, more jumpy movements. Different classes have different kinds of structures. Ballet starts at a ballet bar and goes to the center floor. Jazz will start with kind of a warm-up that looks kind of like Pilates almost and yoga mixed together, and then they do more choreography. The thing that you guys need to know is that not all dance instructors are created equal. So there's not really like a special certificate to be a dance instructor. Some of them came by it really easy, so they don't know how to teach people that are not coming by it easy. Other teachers are really good and really help. So that's kind of where we come in with the teachers that maybe aren't so experienced. We kind of have to show the dancers what the technique should look like. There's different types of dance, but we're going to focus really on ballet because that's kind of the more extreme type of dance as far as the demands on the body. There we go. Okay, so some common injuries that you'll see in dance, it's mostly lower extremity injuries. The upper extremities, they don't have a lot of demand on them, except for in modern dance, sometimes in jazz, but mostly it's lower extremity injuries. So pretty much all the foot injuries that you can have. One that's weird, specific to dancers, is the hallucis longus tendinitis, and that's because of the shoe, wherever it ended up. I don't know where it ended up. There it is. Because in these shoes, you're up here, and so that's a muscle that doesn't usually work in the daily life. But other ones that you've probably already seen, dancers have a lot of knee pain. Snapping hip is very common with dancers. It's sometimes back pain even, and that's from compensations as well. All right. A volunteer? Mariella! I kind of need tight pants. All right, I hope you're a good volunteer. All right, so I'm going to have you try to do first position right now. And you can kind of already tell she made a noise to try to do that. So some of the things that you'll see a lot, and you can see with Mariella, is compensations for forcing turnout. You don't have to stay there super long if you don't want to. But as you can kind of see, her knee is not over her toe at all. And you can also see that she's rolling down onto the arches of her foot, kind of pronating through the foot. Back here, she's arching her back in order to obtain that position. You can see that, a lot of lumbar lordosis. You can get out of it. So basically, these compensations you're going to see in a lot of young dancers because they're trying to obtain that full position, but they don't actually have the range of motion or strength to get there. So that was the example. You're like, I have to get all the way there, and you don't. You don't have to get all the way there. So you don't dance. So probably her actual external rotation is not going to be a 180. Where did it go? A 180 like her there. You're not going to see any new dancers, and that's usually kind of what our population get that 180 turnout. However, they try to obtain it. So a lot of, yeah, those will be like the big compensations you'll see. So you want to, you can sit down if you want to. So what you want to do is first you want to try to get them to realize what their actual turnout is, and then to work in that turnout to not twist through the feet. A lot of the injuries, and you kind of just saw what Mariella did, is the foot injuries can be caused from kind of torquing through your foot. You torque through your knee, torque through the hip even, and then through the back in order to obtain that position. Some of the ways that I this is like a quick and easy way to show people what their actual turnout is I just kind of have them stick her foot out, turn it out, set it down, and set it down. So I don't have very good turnout. And then when you have them do a plie, their knees should be over their toes. Just like if you're teaching somebody squats. You don't want them to be here. So same thing goes if you're trying to go into that extreme range of motion. You don't want them to be compensating and coming forward through that. Does that make sense? Yeah. So everybody find a partner. And I'm going to have you guys correct each other in these poses. So you are forcing your turnout. So he's hyperextending his knee.
So knees here.
Both knees are extended.
So yeah, you want your weight to be there. Yeah. That's the other thing too, is the hyperextension of the knees. Huh? Oh. So he was hyperextending his knee when he was in the position. So I just kind of pushed him forward, had him fix it.
Yeah.
All right, I'm gonna walk around.
Out, and then I'm going to be aiming that way.
So that's kind of what I was talking about with the forcing turnout, is that you want to make sure that your knee can go comfortably over your toe, or else it's going to fall in, just like when we're correcting squats.
I missed the last lesson.
It was better on the standing leg. The other thing that'll throw you off is if you're trying to get too much height out of the back leg, and I think I was telling Great Jack that, then it's going to throw everything off and make you go that way. So you always want to start with like a lower leg and get the form first, and then try to get the height. Most dancers that you see are going to be pretty flexible, but it takes both strength and flexibility in order to get that position that she has. The last one, yeah. I throw that one in there because I know it was really hard. So, yeah, it takes both strength and flexibility because the standing leg has to be strong, and also the back leg has to have that flexibility to go that height. So you'll see the dancer who's like, oh, yeah, I can do this. I can not force my turnout. And then you have them get into that position, and then they're like totally forcing their turnout because they're so used to doing that. So you have to break down whatever the position that's bothering them is, and break it down with those things to make sure that they're not forcing the turnout in that position. The other things that I have at the bottom is decreased core and external rotator awareness. So with decreased core awareness, you're going to see them kind of going into that anterior pelvic tilt. And that's just because they're not even aware of those muscles. So that kind of gives you a direction on where to go with treatment. And also decreased external rotator awareness. The reason that they're even doing this is because the only way that they can find the strength to do that position is to use the floor and to use the friction of the floor to turn their leg out. And it's because they're just not aware of those muscles back there. So for the evaluation, some of the things that you want to look at, obviously, kind of like I was talking about, for functional tests, you would have them do whatever bothers them. I had a dancer, actually I still have her, that the thing that bothered her was kicks. And so we had her do kicks, and I wanted to see, what she was doing. She was kind of going like this. And as you can see, I'm hyperextending my knee. So we corrected that, and Mariella worked with her on the other day, and She doesn't even have pain at all with kicks anymore. So always make sure that you do that, and that'll give you kind of an idea of what they're doing wrong as well. Always look at their passive and active external rotation, because then you know kind of where they're coming from, where their actual rotation is, and how much they're compensating. With younger dancers, they're totally fine turning their turnout back to nothing. Older dancers are a little more frustrated by it, so you just have to explain to them it'll come with time. As long as they make these corrections, they'll get their turnout back. But you have to know where they're coming from. Also, dorsiflexion, because a lot of the landings from jumps, you're in the dorsiflexion, and if they don't even have that range, then they're going to be compensating somewhere else during the jumping portion of class. Core strength is huge, external rotator strength. Dance is kind of one of the few athletic activities that has everything in this weird position. So that's one of the reasons you really want to make sure that they even have the strength to obtain that position. I think most people in the population could use a little strength in that department, but it's really important that they can actually have the strength to do it. Also, the eccentric control of the plantar flexors. This is important in turns and jumps, that when they're landing, they don't just slam into the floor. The ballet technique for landing is you go toe ball heel, so that you can land really quietly. But if you're here and you have no eccentric control, it's just going to slam down, and that's going to come up the chain and cause the ankle, knee, or hip injuries. For balance tests, if you have them stand on one foot, they're pretty much all going to pass that. So that's when you want to go into the little bit harder, like more dynamic balance, and have them do the balance activities in the bent knee position, plie, and in the releve position, to see kind of where. And you're looking at the same things. You're looking at, is their knee going over their toe, or is it compensating? You're looking at the same thing here. Are they going like this? Are they going like that? In that position too, are they able to hold the position? What's a plie? So for a plie, that's the one. It's kind of a knee bend. So you're in this position here. For releve, it's a heel rise. So you're up here. Yeah. I was gonna go over it in the next slide, but since you asked. So for starter exercises for dancers, you can give them any basic external rotator exercise. Clams are always good. Even the harder ones like the monster walk or side steps. Abdominals, pretty much all of them need abdominal strengthening. That one, it's really specific, that makes sure that when they're doing the abdominal strengthening, they're not still in that lordotic position. You'll see a lot of dancers be like, oh yeah, I can do leg lifts, no problem, but they're here. They're doing their leg lift here, which is just reinforcing those bad habits of that anterior pelvic tilt. Any kind of glute. With the knee patients, obviously, the squats don't feel so great. I let them cheat a little bit and go into squats here, and they actually feel a little better. Balance exercises from wherever they're starting from. I love the Bosu for dancers. The Bosu works really well. And then I put seated heel raises as a starter, because if you just go straight to standing heel raises, they're going to go back into all their compensations. So you want to start with the seated heel raises just in parallel, especially for the ankle injuries, because chances are they're either going like that or that. And so you want to make sure that they're able to do the correct position in seated position before they add the weight on their legs, or even add the external rotation. This is a kind of what Ben's question was, the dancer specific. And so this is a little terminology that's good to know. You don't have to know it, but if you want to look back at the notes or ask me what they are. So this kind of basic releves, that would be like a heel rise. So that's when they're ready to come up onto their toes in weight bearing, you would have them just start with something like that. Plies, that's the mini squat. So you're here, but it's always an external rotation. This is after you've already fixed their external rotation. So the tendus, that one I probably have to take my shoe off for. So that would be really, actually it's good for any leg, because you have them in external rotation, you just have them pushing through the floor to point your foot. So it's kind of, it's kind of like the TheraBand exercise, where you're using a TheraBand to go, only you're going through the floor. So with that exercise, you can really practice the external rotation, and you can practice the going through the floor with the heel. Make sure they're not doing any of those compensations with their foot. Passes, that was in the slide before, so that's the one where you have your leg up here. What I like to do for, I think, probably knee dancers especially, is have them practice this and externally rotating both sides. So you can even put a TheraBand on both sides and just have them do like little pulses to practice that external rotation, so that when they go into that position, they're not in those compensated positions. And this is kind of more towards the end. There's sautés. So that would be little jumps, and then they're in the external position. This would be after you practice the pliés and make sure that they have it really well. And you just have them do little jumps. And so that's to make sure that they're not, going back to their landing here or landing here when they're doing the jumps. As far as more advanced stuff than that goes, ask me, I'll let you know if there's any other positions. Any questions on those ones? No? Do the explanations make sense? Yeah, okay. The other thing that you want to let dancers know is kind of like what I mentioned earlier, is they're not going to want to quit. They're not going to want to stop taking dance classes. They're not going to want to stop dancing. So it's important that you can kind of tell them, you can still take class, you just have to modify it. Just do these moves for now and then go into the more advanced moves. So this is actually from an article that I didn't cite, sorry. It's on the other page. So it's kind of like a progression for what things that they can do to go back into class. So they can still take at least part of class. So it starts with just double leg activities with feet flat, which is like literally nothing. So they would just be holding onto the bar and do, this kind of stuff. So they could still do like the tendus, things like that. Then you would start doing like the more balanced activities, and that's anything up here that they can do in the air. Third would be they can start coming onto the heel rise. So they can start doing the activities where they're on both legs and just coming up. There's several positions that they could do that. It's not just this one. You can kind of go into different positions and do that. And then little small jumps like we talked about, just little jumps. Then you start doing, and these seem kind of counterintuitive that they can start doing the small jumps before they can do the single leg stuff. But the jumps are really, really small. So it's just kind of like little, and that's actually easier than doing the big single leg stuff. And so that's when they can start doing like the single leg heel raise, activities like that. So that's just for the bar where they're holding on to something. This is called, I call this the bar sometimes, but this is basically what a ballet bar looks like. It's just something that they can hang on to start class. Then they'll go to the middle of the floor, and that same progression applies. So you start with just feet flat, then you go through the progression as far as that goes. Does that all make sense? So a couple tests for when a dancer is ready to go back to dance. So this is one that I found in a research study. Where basically what it looks like is they're in this position here, and they have one hand here, and they're touching the floor and coming up 4 times without letting the knee go in, without losing balance, and they do that 4 times in a row. If a dancer can do that after an injury, then that kind of tells you that they have the strength and stability that they can start going back. The other one is vertical jump test. This helps with like unilateral injuries, because then you can compare one side to the other as far as that goes. I probably wouldn't have the data for bilateral, what to do. The other thing is point shoes do require a lot of strength and stability of the ankle. And the other thing is if you have a patient who's under the age of 11 and says she's on point, that's not good. 11-year-olds don't have, well, when they turn 11, they finally do start having it, but anything younger than that, they just don't have the bone structure to be able to do something like this without permanently damaging their feet. The other thing is they just don't have the strength. They don't have the strength in the ankles to be able to hold this position without risk of, twisting their ankle or compensating in some way. As you guys know, plantar flexion is the most, most injuries happen for ankle twisting in plantar flexion. So, yay, that's plantar flexion. So, to its full extreme. So, the dancer that goes on point has to be extremely strong. If you get a 10-year-old and they're turning 11 and they had an ankle injury and they want to go onto point, that's when this comes in a lot. You want to make sure that they're definitely strong enough in their ankle in order to go onto those shoes. Dance teachers kind of have an idea of when their students are ready, but like I said before, they vary in skill. Some dance teachers have a good understanding of anatomy and kinesiology, while others don't. So it just it really depends where the student's at, like what studio they're at that they can do something as extreme as dancing on their toes.
Vertical jump test, is that a single leg jump? Is that better?
I think so. It's the one where you like put a measuring stick and then just see how high they can hop. I think they do it 5 times. Yeah, and then you take like the average. I know there's a double leg one too, but I don't see any reason why you couldn't do a single leg one. So, and if they're injured on one side, then that could give you a really good idea if they're back to baseline.
But they can just complete 5?
So they would do like if they injured their left leg, you would have them do 5 on the right, and kind of take the average of what that, and then have them do 5 on the left. And if it's equal or close to equal, then you have a good idea that they're 80%. Yeah, the 80% rule. Yeah, 80% of equal. Then you're like, okay, you can start going back into jumping. With the jumps in class, it's not just like you do like one. It's like like basketball. You can do the jump test and fail it, but not hurt yourself. But if in dance class, if you fail the jump class and then do dance class anyways, then you're more likely to re-injure yourself. because there's a lot of jumps that happen consecutively, one after the other. So if you don't have that strength to do it, and not all the jumps are, they're not all small jumps. They're like some of them are really big, so you have to have a even higher than some basketball jumps, because you saw her leg is straight up in the air, and then she has to land on that and not twist something or so. That one is important. I didn't see a whole lot of research about readiness to return, unfortunately. I have a dance teacher colleague of mine she's in PT school right now, and she's doing a lot of research. I asked her to send it to me, and she totally didn't. So maybe I'll get it someday. But a lot of this information I was in a dance journal club in college. And so we looked at a lot of articles about, readiness to return to dance, about, what things to look for as far as it goes. The other things, too, that are important is because of the compensations in like the anterior pelvic tilt and everything like that, the iliopsoas tends up being really tight if people are compensating. Oh, I didn't put that one in there. I should have. So Thomas test. Test their iliopsoas. Make sure that that's not, limiting them from even obtaining the positions that they're trying to obtain. The other thing that's huge is to encourage cross-training. A lot of little dancers will come in and say that they dance 7 times a week, and that is it. So there was a study that I looked at that showed that with low aerobic capacity, dancers that are a higher risk for injury. So when we look at dance videos, we're like, dang, that's a lot of aerobic. However, in a dance class, there's only about 10 minutes of aerobic activity built in. And I think that one was being generous, that there's only about 10 minutes. So in order to get the aerobic capacity required for performance, especially, the dancer needs to do something outside. So they need to do something outside of dance to get the heart rate up, to prevent those injuries from happening. Other things, dance class itself doesn't have any built-in strengthening. Like there's no weightlifting, or some teachers will do plank, but it's not part of it really. It's part of the class, so they need to be able to do that stuff outside. Some are really motivated and they'll do plank and clams outside. A lot of people are better off doing, I'm one of them, I'm better off doing classes. So stuff like Pilates, yoga, I don't know if you guys heard of bar method. That's another good one, or pure bar. All those kind of activities are something that requires the body to do something different than dance, and it helps to make the dancer stronger so they can do what they're doing. The other thing that in the study that showed that dancers with a low BMI were more likely to get injured. Dancers have a certain physique, especially ballet. There's a certain desired physique. Some people can be really thin and totally healthy, while others trying to obtain that thinness often lose out on nutrition. And those are the ones that are going to have problems as far as injury occurrence and then injury healing time. So their healing time is a lot longer once they do get injured. So you want to lightly encourage nutrition. High schoolers never sleep, as we know, so encourage sleep as well. To try to get them to heal faster. All right. Any questions?
And is it like 2 or 3 exercises that you could give them that would be good for conditioning for the type of dance they do?
Yeah, for ballet, I really like clams and plank. Those are kind of my favorite ones. And for ankle injuries, just doing heel raises, eccentric heel raises. So Yeah, those, I mean, those are my favorite. Really, any external rotator exercise, if you can think of any others besides clams. I've got enough planks too easy, make it harder. Doing weird balance things, like even this one that's not a ballet move, but having them do stuff like the golf pickup, balancing on the bosu, stuff like that. But the two muscles that are most important are the abdominals and the glutes, or muscle groups. So, and that's usually where the dancers will compensate. For the most part, you're not really going to need to give them stretches. Because the problem is probably too much flexibility. There's a little bit in the way that you can kind of correct splits to make sure that they're doing them in a better way. For the dancers, especially that have like the tight hip, if they're compensating with the anterior pelvic tilt, they're overusing their quads and underusing their glutes. So that'll be real tight. So doing manual on the quads is helpful. Obviously, if they like have a muscle injury, wherever it is, manual's gonna help loosen that up too. Like if they have a hamstring injury, always a good start. With the people that end up doing best in ballet are people with either slightly anatomically too much external rotation or normal. So usually the people that have like excessive internal rotation give up because it's just, yeah, they're just not going to obtain it and it hurts, and so they don't go for it. So you might see somebody that has more external than internal, but as long as they're using their external rotators and their core, then it's okay. I don't have internal rotation. Oh, not much. That one's worse. I know my left leg's worse. Anything else? No. I guess I went kind of short, huh? It's okay. Yay.